Dr. Patrice Harris, now a psychiatrist and the former president of the American Medical Association, now the CEO of EMED. Doctor, thank you so much. How can we all avoid hitting that pandemic wall?
Well, Shep, first of all, thank you so much for having me and for having this conversation about mental health, because this is a first step. We really have to normalize having conversations about mental health. There's always such a stigma about talking about mental health and having anxiety and depression. And in some ways, we feel like we may be burdening others. But certainly, I want everyone to, first of all, give themselves grace and space to feel how they are feeling. Know that we are not helpless. And yes, we are all hitting that wall, but it is time to build on our reserves, call on those coping skills that we typically use. Make sure we are getting some activity. I know in the North it's difficult, but put on your favorite artist and dance around. Make sure you're sleeping and try to eat. And by all means, Shep, we should not be turning to alcohol to cope.
Yeah, I hear you. You know, sometimes looking at those vacation photos and videos is helpful, but then you just want to be there. You know, before COVID, mental health was already such a big issue here, and now home and work lines are blurred. Aside from looking at those photos, or I don't know, how do we reduce stress in our lives when it's all so complicated?
Well, I think we should definitely lower expectations. Shep, I don't know if you remember, but there was a parent maybe last April who just perhaps threw up her hands one day and said, look, I cannot be a perfect parent, a perfect teacher now, and continue to do my job. And so I think we should put less pressure on ourselves, lower those expectations, know that we cannot do it all. We need to reestablish some routines, even if they are new routines. Again, make sure we are getting some activity, even if it's a 2-minute break walking around the house between Zoom meetings. I've been on Zoom all day. And I do know that there is Zoom fatigue, especially when it's related to work. But we do need to stay connected. And so make sure there are times that we use Zoom, or you know what, Jeff, just pick up the phone in the old-fashioned way and call friends or loved ones, because we still do need to maintain connection.
Yeah, no doubt. My dad's 92-ish. He got his second shot this week, so in a couple of weeks, he's like ready to go watch the Rebels play baseball. The rest of us probably have a little while longer to go. But when we get there and things are a little better, does this mental health problem continue, or does it likely fade away with the virus?
Shep, this mental health problem is going to continue. By the way, that won't be new. I mean, we had issues around a severely underfunded mental health infrastructure pre-COVID. We didn't have equitable access to mental health resources. So we are going to have to double down and triple down. There's a lot on our to-do list when we get through the acute phase, but we are going to absolutely have to keep this conversation around mental health at the forefront. And I do want to make sure that folks know that, you know, there are times when you need to ask for help. It's okay not to be okay. And so when your coping mechanisms no longer work, when you are not coping, or we have to make sure that we are keeping our eyes on the children. I'm a child and adolescent psychiatrist. When our children are becoming more withdrawn, we need to make sure that we seek out professional help, and it's no shame in doing so.
Shepard Smith here. Thanks for watching CNBC on YouTube.